As healthcare providers shift from volume-based care to value-based care, they may be asking themselves, can I do this in my EHR, or do I need a supplemental solution, such as care management software, in order to effectively manage these programs? In this video, we'll explain the differences between care management software and EHR technologies, and answer the question, can I do this in my EHR, or do I need care management software to effectively manage value-based programs? Hi, this is Lauren from ThoroughCare. Every day, we're helping companies across the country with implementing value-based care management software solutions for some of Medicare's most profitable programs. Here at ThoroughCare, we've worked with several different EHRs, some good, some bad. We'll take you through the key differences between an EHR and a care management solution to determine the best fit for your group's needs. First, let's start with a quick overview of what each of these are. An EHR is short for Electronic Health Record. It's basically a digital copy of the patient's paper chart. The EHR is a great way for the provider to see all of the patient's health history, to share data with other providers, and perhaps most importantly, the accuracy of what the providers are actually billing for. The EHR was really built to manage volume-based programs. It might be limited on how to manage these patients in value-based care programs. Care management software is designed to supplement the EHR for these value-based care programs. The purpose of care management software is to fill gaps in care, to improve patients' health outcomes, lower risk of both the patient and provider, and ultimately lower healthcare costs. Care management software does not replace an EHR, nor should it. In fact, you'll still need an EHR to participate in some of these value-based programs. The EHR is the central point for patient data, but the care management solution will help you to perform the functions needed in order to bill for value-based programs. Now that we know what both of them are, let's look at how they're different. For the EHR, patient information tends to be much more thorough and includes the entire medical history of the patient. Care management software usually doesn't contain as much medical history as the EHR does. Providers really only pull the relevant medical information needed from the care management tool for some of these value-based care programs. Basically, care management solutions do not store the entire patient's medical history. That's the EHR's job. Most EHRs offer little to no data sharing between other EHRs and healthcare systems. It can reduce the quality of care by limiting collaboration between providers while trying to improve patient outcomes. Let's say a primary provider, a specialist, and even a hospital want to collaborate to improve patient care, and they don't operate on the same EHR. It can be very cumbersome to share information and to gather the information needed to treat the patient effectively. It ultimately lowers the quality of care the patient might receive. On the other hand, care management software allows sharing of data effectively and efficiently. Care management software allows data to be exchanged across any EHR. Through the help of reports and summaries, this data can easily be attainable from the care management solution itself. The benefit of sharing information through care management software is that it improves collaboration among providers and also lowers the risk of duplication, miscommunication, and errors. This improves the patient's health by keeping the entire care team involved in the patient's overall health. It will ultimately improve patients' health outcomes. Let's look at using the EHR as a care management tool. Some EHRs weren't built to be care management tools, nor do they want to be. The EHRs that do offer care management solutions are clunky and require extensive manual input from resources such as care managers. It affects the quality of care given to the patient because ultimately it's not patient-centered. At times, it doesn't even focus on the items that are most important to the patient. So with a care management tool, it really allows you to pinpoint patient goals, barriers, conditions in a way that an EHR might not be able to. The user interface with care management solutions will give you dashboards or work lists to properly sort and filter your patients and prioritize care management tasks, such as care plan creation and revision, as well as some important assessments that may be done for other value-based care programs. The care management tool should ultimately greatly improve the care manager's performance due to the automations, the reporting capabilities, and the overall functionality, ultimately allowing them to become more efficient, getting the patient the exact care they need. It greatly improves the care of the patient. You focus on the conditions or items that are most important to the patient within a care management solution and allow for constant revision and updating when necessary. For some providers, an EHR might be a good fit for what you're looking to accomplish for some of these value-based programs. However, care management software gives you a set of specific tools allowing you to effectively and efficiently manage your own in-house solution for some of Medicare's most profitable programs. If you're interested in learning more about care management software or about ThoroughCare software solution, click the link in the description below to download a free copy of our Care Management Software Solution Buyer's Guide. Be sure to like this video, and if you have any additional questions, please feel free to leave a comment below and we'll be happy to help. Thanks for watching.